The juxtaglomerular apparatus, the JGA, plays a major role in regulating kidney function, blood pressure, electrolyte balance, and water balance. In this video, I'll talk about JGA function when sodium and chloride are particularly high. First, I need to orient you to where the JGA is. Here you're seeing cortex and inner medulla, part of the kidney from outermost to innermost part, and here is a nephron, and the part we're interested in is right here, where the blood supply coming in, the afferent and efferent arterioles, here's the glomerulus, is very near to a part of the distal convoluted tubule. So that's the JGA. Now I'm showing you a cross-section through a glomerulus and the JGA. The JGA is this region in here. To remind you, blood comes in through the afferent arteriole, goes through all these capillaries and out through the efferent arteriole. Water, waste molecules, and valuable molecules pass into the proximal tubule, valuable molecules reabsorbed. By the time the filtrate, now processed, gets to the distal convoluted tubule, there's water, ions. By the time the processed filtrate gets to the distal convoluted, tubule, in this region of the JGA, it has water, ions, waste molecules, few valuable molecules left. We are going to care about these molecules here of the macula densa that are sensing what's in the distal convoluted tubule, some secretory cells nearby, and not shown here, smooth muscle cells that ring the afferent arteriole and efferent arteriole. They can contract, constricting and reducing blood flow, or they can relax, dilating, allowing more blood flow through. This sketch shows the parts that we're going to need. Here's the glomerulus to the proximal convoluted tubule, the afferent arteriole bringing blood in. These are the glomerular capillaries. I'm only showing one, but of course there would be a network, and the efferent arteriole as blood leaves. After the proximal convoluted tubule, the loop of Henle, the developing urine would be coming back through the distal convoluted tubule here in the juxtaglomerular apparatus. These are the cells of the macula densa, and ringing the afferent arteriole and efferent arteriole would be smooth muscle that can constrict or dilate these arteries. When sodium and chloride are high, the macula densa cells detect this change. Let's zoom in. NKCC channels, sodium, potassium, chloride channels, allow ions into the cell. There are aquaporins in these cell membranes, and that allows water to enter the cell because of that high concentration of ions. That causes these cells to stretch. That stretch affects a channel we haven't talked about before. This is an ATP channel that allows ATP to cross membranes. In this case, it's a stretch ATP channel. ATP crosses the plasma membrane, is converted by an enzyme to adenosine. Remember, ATP is adenosine triphosphate. That adenosine binds to receptors on the smooth muscle that's ringing the afferent arteriole, that's bringing blood in. In this case, it's a G protein coupled receptor, so the G protein opens a calcium channel, calcium comes in, and of course calcium will cause muscle contraction. So these smooth muscles contract, that reduces blood flow, and here in the glomerular capillaries we have less blood pressure because of that reduced flow, which means less water is escaping to get into the proximal convoluted tubule. So this alone will reduce the loss of water from the organism. That's not the only effect. The adenosine also acts on receptors, but it's a different adenosine receptor on the smooth muscle around the efferent arteriole. In this case, it inhibits contraction, and so these relax, and the efferent arteriole dilates. That dilation allows more blood to escape. So we have two effects. We have less blood coming in, we have more blood leaving. The two together greatly reduce blood pressure in the glomerular capillaries and reduce water loss. In sequence, high dangerous sodium and chloride levels. 1. Allow in ions. 2. Water moves in by osmosis. 3. Cell stretch. 4. ATP leaves the cell. 5. Is converted to adenosine. 6. Binds to adenosine receptors on smooth muscle around the afferent arteriole, which allows in calcium, which causes constriction, and that vasoconstriction reduces blood flow. That lower blood pressure reduces water loss, the tendency for water to leave Bowman's capsule. The adenosine also binds to adenosine receptors on the efferent arteriole, where blood is leaving, but here it causes relaxation. That allows increased blood flow out of the glomerulus, so that's a second mechanism to lower blood flow and even less water loss. So potentially dangerously high levels of sodium and chloride result in retention of water.